Good day, this is Dr. Hans Berendes. I'm Dr. Rutledge's anesthesiologist. We're here in the operating room today, and I'm going to discuss with you total intravenous anesthesia, also known as TIVA. TIVA is utilized in bariatric patients for smooth wake-ups, decreased amount of nausea, and increasing safety in patients that are undergoing laparoscopic mini gastric bypass. Dr. Rutledge has utilized the total intravenous anesthetic, or TIVA, in thousands of gastric bypasses that have been performed nationwide. The benefits of using total intravenous anesthesia are manyfold. Initially, there is a great speed of induction of the anesthetic. It's easy to maintain, and these operations last anywhere from 18 to 40 minutes, and this is the perfect anesthetic for this duration of surgical time. The TIVA is also utilized to decrease the amount of post-operative nausea and vomiting, and we see a lot less than utilizing gas anesthetics or what's called inhalational agents to maintain the anesthetic. We avoid using any anesthetic gases in all of Dr. Rutledge's patients. All of the patients get total intravenous anesthesia, and they wake up very smoothly, very quickly. There are no problems with airway compromise. They are very alert. Their cognitive status is much improved over the utilization of inhalational agents. They have much less nausea and vomiting, and we notice that in the recovery room immediately. Dr. Rutledge has performed a study on his gastric bypass patients and has found that the nausea and vomiting is down to about 5 to 7% in comparison to utilizing gas anesthetics that are roughly around 30%. So the total intravenous anesthesia decreases the risk of nausea and vomiting right around 20% in most of mini gastric bypass patients.
And the other thing, of course, is safety, because if you think about it, you and I have done about 300 or 400 cases together, and how many reintubations have we had? I haven't had one. So, and reintubation is the concern in using gas anesthetics, because they can have the gas anesthetics, which dissolve in the fatty tissue, sometimes sneak back in. And one of our patients for tomorrow had a respiratory arrest following her routine wake-up from a general surgical procedure. She was very frightened about the anesthesia, and I explained to her that that was a risk that was much more common after gas anesthetics than TIVA.
Right.
That also may be related to narcotic doses too.
Absolutely. Narcotic dose plus some gas anesthetics, but if you think about it, using such short-acting drugs, the total intravenous anesthetic, and no fat storage of the chemicals that we're using, hopefully that gives us a better risk ratio for respiratory depression post-op, and certainly it's shown in the good results you've had with anesthesia.
Well, yeah, in low concentrations of gas, you really want to get into it.